Dear audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 10th lecture on Hematology. Today, day 5 of Leukemia. Today's topic is Leukemoid reaction. Before going to discuss about Leukemoid reaction, we have to recapitulate leukemia. You know, leukemia is a blood cancer, and we can define leukemia: neoplastic proliferation of hematopoietic stem cell with appearance of immature cell in peripheral blood with or without infiltration in other organ or tissue is called leukemia. So, suppose this is the bone marrow, and this is the medullary cavity containing bone marrow, and this is the bone. By definition, within the bone marrow there is hematopoietic stem cells. These are hematopoietic stem cells, and neoplastic proliferation of these hematopoietic stem cell, that is cancer of this hematopoietic stem cell, and there is appearance of immature cell in blood. So, cancer of the hematopoietic stem cell, appearance of immature cell in blood, and these immature cells is called leukemic cells. These leukemic cells may infiltrate lymph node, spleen, liver, etc., and so the patient may come to you with organomegaly. So, in leukemia we get leukocytosis, we get immature cell in peripheral blood, we get organomegaly. Bone marrow reveals picture of leukemia, and clinically patient may come to you with fever due to frequent infection, patient may come to you with leukocytosis, patient may come to you with symptoms of anemia, etc., etc. So, now come to Leukemoid reaction. Leukemoid reaction. First come to definition of Leukemoid reaction: a condition that resembles clinically with leukemia. Blood picture shows immature cells, but bone marrow does not suggest leukemia, is called Leukemoid reaction. So, it is a clinical condition. It is a condition that resembles with leukemia clinically. The patient, like leukemia, patient may come to you with fever, patient may come to you with the infection like leukemia, and patient may show blood picture like that of leukemia. Patient's blood picture may show immature cell, but if you do the bone marrow of that patient, bone marrow does not show any features of leukemia. So, this is called Leukemoid reaction. So, it is leukemia-like condition, but not leukemia. And we can recapitulate: a chronic inflammatory cell, epithelioid cell. Epithelioid cell. Respected audience, you know, epithelioid cell is one of the chronic inflammatory cell. It looks like epithelium structurally and functionally. Structurally and functionally, this chronic inflammatory cell looks like epithelium, but actually it is not epithelium, and it is called epithelium-like, that is epithelioid cell. So, leukemia like condition is called Leukemoid reaction. Now come to types of Leukemoid reaction. One is myeloid Leukemoid reaction. Another is lymphoid Leukemoid reaction. First come to myeloid Leukemoid reaction. First come to myeloid Leukemoid reaction. What is myeloid Leukemoid reaction? Leukemoid reaction that resembles with the myeloid leukemia is called myeloid Leukemoid reaction. So, the Leukemoid reaction that resembles myeloid leukemia is called myeloid Leukemoid reaction. Now come to what are the causes of myeloid Leukemoid reaction. Dear audience, the conditions where there is leukocytosis and with predominating cells are the neutrophil, that may be the causes of myeloid Leukemoid reaction. Again we repeat, the conditions where we will get neutrophil leukocytosis, that are the conditions, that are the disease, that are the situations are the causes of myeloid Leukemoid reaction. One is infection. What type of infection? Acute pyogenic infection. Acute pyogenic infection. Example, one is acute appendicitis. Acute appendicitis. Another is acute pyogenic meningitis. Acute pyogenic meningitis. Another cause is burn. Dear audience, in both acute pyogenic infections like acute appendicitis, acute pyogenic meningitis, and also in burn, patient shows leukocytosis and there is neutrophil leukocytosis. So, in both cases, there is neutrophil leukocytosis. There is neutrophil leukocytosis. Neutrophil leukocytosis. And in both cases, there is rapid production of neutrophil within a short time. In both cases, there is rapid production of neutrophil within a short time. So, what happens here? Rapid production of neutrophil within a short time. Dear audience, you know neutrophil is derived from granulopoiesis. If you consider this is the myeloblast, myeloblast in bone marrow. During development or during granulopoiesis, we get from myeloblast promyelocyte. Then we get myelocyte, and from myelocyte we get metamyelocyte, metamyelocyte, and from here we get the band from cell, and from the band from cell mature neutrophil is formed, mature neutrophil, and this mature neutrophil comes in blood from bone marrow. So all these cells are present in the bone marrow, and from the bone marrow we get in blood mature neutrophil. If bone marrow is stimulated for overproduction of neutrophil within a short time, if within a short time huge number of neutrophil is to be produced in acute infection or in burn, then along with the massive neutrophil, some immature cells like band from cell, like metamyelocyte, like myelocyte, like promyelocyte, like myeloblast may come in blood. So due to rapid production of huge number of neutrophil within a short time, some immature cell along with the massive neutrophil may come from bone marrow in blood, and this is the blood picture of myeloid leukemoid reaction. Dear audience, if anybody suffers from myeloid leukemoid reaction, there will be leukocytosis in the blood picture. There will be immature cells like promyelocyte, myelocyte or myeloblast, and patient will suffer from fever. So clinically patient resembles with leukemia. Blood picture shows or suggests leukemia, but if we do bone marrow of that patient, bone marrow will not suggest any leukemia. So this is myeloid leukemoid reaction. Now come to lymphoid leukemoid reaction. Dear audience, if you want to define what is lymphoid leukemoid reaction, we can say leukemoid reaction that resembles lymphoid leukemia. That type of leukemoid reaction is called lymphoid leukemoid reaction. Now come to causes of lymphoid leukemoid reaction. I have told you in case of myeloid leukemoid reaction, the diseases or the situations where there is overproduction of neutrophil within a short time, that are the causes, or that are situations the causes of myeloid leukemia reactions. So what are the causes of lymphoid leukemia reactions? The situations or the diseases in which there will be rapid production of lymphocyte within a short time, that are the causes of lymphoid leukemia reaction. Again we repeat, the situations or the diseases associated with rapid production of lymphocytes within a short time are the causes of lymphoid leukemia reaction. Now to come to causes, what may be the causes? It may be tuberculosis, pertussis, whooping cough. So these are the causes of lymphoid leukemia reaction. Dear audience, you know, if the stem cell or primitive cell, from where we get lymphoblast, and from the lymphoblast we get mature lymphocyte, either small or large. So small or large mature lymphocytes we get from the lymphoblast, and this is lymphopoiesis. This is lymphopoiesis. This is lymphopoiesis. So during lymphopoiesis we get mature lymphocytes from lymphoblast, and these mature lymphocytes come in blood. If there is rapid production of lymphocytes during tuberculosis or in pertussis. If there is rapid production of huge number of lymphocytes in a short time, along with the invasive lymphocytes, some lymphoblasts may come in blood, and so the blood picture resembles leukemia in that case. As the invasive cells are lymphoblasts, so it is a case of lymphoid leukemoid reaction. Respected audience, now come to how can we differentiate leukemoid reaction from leukemia. Now come to differences between leukemoid reaction. Leukemoid reaction and leukemia. So differences between leukemoid reaction and leukemia. First one, clinical features. Again, recall leukemia reaction resembles with leukemia, but actually not leukemia. So clinical features, in case of leukemia reaction, clinical features of causative disorder is obvious, usually obvious. So clinical features of causative disorder often obvious. As for example, tuberculosis. Dear audience, you know, if anybody suffers from tuberculosis, either extrapulmonary tuberculosis or pulmonary tuberculosis, there will be evening rise of temperature. If pulmonary tuberculosis, there will be dry cough. Patient may suffer from anemia, anorexia, and weight loss. So these are very much obvious in case of tuberculosis, and you know tuberculosis is one of the cause of lymphoid leukemoid reaction. Then clinical features in case of leukemia may be lymphadenopathy, there may be splenomegaly, hepatomegaly. Then total leukocyte count, TLC. In case of leukemia reaction, seldom exceed 1 lakh per cubic millimeter of blood. Seldom. In case of leukemia reaction, TLC seldom exceeds 1 lakh per cubic millimeter of blood. But in case of leukemia, usually exceeds. 1 lakh per cubic millimeter of blood. Number 3, invasive cells. Dear audience, you know, if we declare a case of invasive cell either in bone marrow or in peripheral blood, in case of leukemia, it should be more than 15%. So in case of leukemia reaction, the invasive cells is 5 to 15%. But in case of leukemia, it is more than 15%. Then come to platelet. Total platelet count in leukemia reaction is normal. That is, there is no thrombocytopenia. But in case of leukemia, in acute myeloblastic leukemia, in acute lymphoblastic leukemia, there will be thrombocytopenia. But in case of chronic myeloleukemia, the platelet count is normal. So, thrombocytopenia in acute lymphoblastic leukemia and in acute myeloblastic leukemia. Then toxic granules in neutrophil. Toxic granules in neutrophil. Dear audience, you know, if this is the neutrophil and there is fine granules, if anybody suffers from infection or acute inflammation where there will be neutrophil leukocytosis, due to infection, this neutrophil shows toxic granules within the cytoplasm. Toxic granules within the cytoplasm. These are the toxic granules in the cytoplasm. As infection, acute pathogenic infection is the cause of myeloid leukemia reaction. So, we will get toxic granules in neutrophil in myeloid leukemia reaction. So, toxic granules in neutrophil usually present in myeloid leukemoid reaction. This toxic granule is absent in leukemia. Then come to bone marrow. Bone marrow, by definition, leukemia reaction reveals or does not suggest any leukemia. No picture of leukemia. So, although immature cells in peripheral blood, although clinically resembles with leukemia, bone marrow does not show any picture of leukemia. But in case of leukemia, full picture of leukemia. Picture of leukemia. So, these are the differences between Leukemoid reaction and leukemia. Dear audience, again we recall, leukemia reaction is not leukemia. Clinically it resembles leukemia as per sign symptoms, and blood picture suggests leukemia due to presence of some immature cells, but bone marrow does not suggest any leukemia, and this is leukemia reaction. This is up to leukemia reaction. Today up to this. Thanks all.